The National Health Service, the healthcare system in England, by Manette Dimitrov in the Faculty of Medicine and Dentistry and Undergraduate Summer Student Project. So briefly about the outline, I will talk about the introduction and a bit of the background of the National Health Service. I will speak about the aims and the funding, the structure of the National Health Service and the services provided. I will talk a bit about the primary and the secondary care provided and the mix in public and private treatment, and as well the reforms that have taken place and which include the Health and Social Care Act that occurred in 2013. The National Health Service is one of the best known publicly funded healthcare systems in the world. It actually has a higher ranking than Canada, the US, and Germany. It is one of the most efficient, most egalitarian, and most comprehensive healthcare systems, and it covers everything from antenatal screening, routine treatments for long-term conditions, transplants, end-of-life care, and more. It is primarily funded through general taxation. The National Health Service was established in 1948 by Anya and Bevan. It has four publicly funded healthcare systems in the countries of the United Kingdom, including England, Wales, Scotland, and Northern Ireland. In this presentation, I will speak primarily of England. All four publicly healthcare systems are entirely independent, as since 1999 they have developed different policies such as managements, rules, and political authority that each make them unique in their own different way. The National Health Service is based on three core principles, and that is to meet the needs of everyone, to make sure it's free at point of delivery, and that it's based on clinical need and not ability to pay. They put more emphasis on more delivery of services and provision of hospitals into communities. The aims are actually the same in all four countries in the UK, but since they are independent, they are pursued within different political contexts and policies. An interesting fact is that since the National Health Service was established, the life expectancy has rose and infant mortality reduced. Generally, patients are satisfied with the care they receive from the National Health Service. So out of 11 nations, the United Kingdom's National Health Service has actually ranked first in the 5 areas of performance, which are quality, efficiency, access to care, equity, and healthy lives, or health outcomes. This is measured by total national spending on healthcare as a percent of GDP and the amount spent on healthcare administration and insurance. For accessibility, the United Kingdom has relatively short waiting times for basic medical care, but they do have longer waiting times for specialist care and elective and non-emergency surgery. Switzerland ranked second and Sweden has ranked third. And as well, according to the World Health Organization, or WHO's ranking of the World Health Systems, the United Kingdom ranked 18th. So this is a picture portraying the ranking of the National Health Service in the UK out of the 11 nations and their healthcare systems. And as you can see, the United Kingdom is bolded in red and is ranked first in the 5 areas that I have just spoken about. This information incorporates patients' and physician survey results on care experiences and ratings on various dimensions of care. It includes information from the most recent 3 Commonwealth Fund international surveys of patient and primary care physicians about medical practices and views of their country's health systems from 2011 and 2013. It also includes information on healthcare outcomes featured in the Commonwealth Fund's most recent 2011 National Healthcare System Scorecard and from the World Health Organization and the Organization for Economic Cooperation and Development. So those who have free access to the National Health Service are legal UK residents. So those who have a permanent resident status and are fully registered within the system with an NHS card number, which you actually do through a physician. Legal immigrants, European citizens, so European health insurance cards work, and they must have reciprocal arrangements with the UK, specifically the European countries. And as well, overseas students with a visa to study, but they must be there for 6 months or more. Those who are tourists or have tourist visas do not have free access. They must pay in advance or sign an undertaking to pay. So the National Institute for Health and Clinical Excellence, or otherwise known as NICE in the UK, and again this specifically regards to all 4 of those countries with the NHS, This institution improves outcomes for people using NHS or other public health and social care services by assessing the quality of clinical evidence and give guidance to prevent ill health and promote healthier lifestyles. Guidelines also summarize the evidence behind the recommendations and explains how the recommendations were derived from the evidence. There are evidence-based recommendations on a wide range of topics, such as preventing and managing specific conditions, improving health and managing medicines in different settings, providing social care to adults and services, and planning broader services and interventions to improve the health of communities. NEAS also develops quality standards for those providing or commissioning health and social services and provides information services for commissioners, practitioners, and managers in health and social care. When it introduces new guidance, it includes a commissioning guide and toolkit to enable commissioners to see what changes might be necessary in their health economy and how a new technology might affect the local population. So the National Health Service in England, which is what I'll be talking for the rest of this presentation, is the largest workforce consisting of 1.7 million people. It is controlled by the United Kingdom government through the Department of Health, which is responsible for health and social care matters in the NHS and along with a few other elements of the same matters in the Scottish, Welsh, and Northern Ireland government. They put greater emphasis on patient choice and use of private sector providers, and actually more so than in Wales, Scotland, and Northern Ireland. In England, I will talk about later how recent reforms have started to encourage more competition. However, there is a rejection of competition in Wales, Scotland, and Northern Ireland. So the funding in England, like I said earlier, primarily comes from general taxation. It also comes from private finance, prescription charges, some dental and optical services, overseas visitors and their insurance, hospital parking and services, and as well as block grants, which is given from the UK Parliament to each developed national government to spend on local needs, and they can choose how much of that block grant they want to spend on the healthcare system. So the structure of the National Health Service includes the Department of Health, and like I said before, it's responsible for the NHS England politically, and so they hold responsibility for health and social care matters in the NHS. The Health Board delivers NHS services and manages them, and Health Watch ensures views of the public are taken into account and gives voice in decisions that affect people. the monitor regulates all providers of health and social care. They promote competition, they regulate the prices, and ensure the continuity of services for NHS Foundation trusts. So NHS providers who want to put up more services need to actually register with the monitor first. NHS England's main role is to improve health outcomes for people in England, such as improving outcomes and quality of care, oversees the operation of CCGs, which I will talk about next, and allocate resources to CCGs, and commission primary care and specialist services. CCGs, or otherwise known as clinical commissioning groups, are led by GPs, general practitioners, hospital doctors, and nurses. They supervise the NHS services in their local areas. They hold the budget independently, so they are known as the fund holders in the NHS. So some examples of what they commission would be planned hospital care, rehab care, urgent and emergency care, most community health services, mental health, and learning disability services. So here's a picture describing the infrastructure of the National Health Service. So as you can see, what I talked about, the Department of Health and the clinical commissioning groups, as well as the monitor, it's good to note that, as you can see, it's regulating all the services, and it also regulates the prices of the services and ensuring that they're providing quality services for the citizens. So most services are free at point of use. So those include doctor visits, including doctor advice, surgical procedures, medications, x-rays, MRIs, and hospital services. Some services do charge, but at a lower cost than private healthcare providers. So that includes dental care, optical care, prescriptions, and aspects of long-term care, such as dementia and chronic disabilities. Non-NHS organizations provide services as well, and that would include private, voluntary, and local authority providers. And these all compete with NHS trusts. So according to the Health and Social Care Act that took place in 2013, the monitor will regulate the prices paid to the providers to ensure that competition is encouraged. So primary care is actually very essential in the United Kingdom. It is provided by family doctors, dental practitioners, pharmacists, and opticians. So it is usually the first point of contact with most NHS services. So for example, an individual that needs to go to the emergency will actually need to contact their general practitioner first to ensure they need to go. General practitioners are the gatekeepers of the healthcare system. They make referrals for secondary care, such as hospitals or specialists, and they are part of the CCGs. And that provide NHS care. General practitioners can be self-employed, or since 2011 they can be on salary. There is a promotion of large primary care facilities, so that provides diagnostic and outpatient services found in secondary care. However, they're not always welcome as they compete with a lot of local general practices. Secondary services are provided by hospitals, specialist care, and NHS trusts, which are responsible for providing services such as hospitals, health centers, and community health services. They provide quality care and meet targets for the speed of treatment and the need to stay within their budgets. And if they do so, they can actually become foundation trusts. These trusts in general do provide competition between providers. Foundation trusts have a greater responsibility, but they have more freedom of action and are local governors. They lay down certain financial, quality, and partnership requirements. With regards to NHS trusts, some examples um, are NHS acute trusts, which are responsible for hospitals and treatment centers and specialist care, NHS ambulance service trusts, NHS mental health trusts that manage and treat mental illness, and NHS care trusts, which provide health and social care services. So there is some treatment that is provided by the private sector. It helps reduce waiting lists and provides competition with the public healthcare system. Like I said, that has been more encouraged since the Health and Social Care Act 2013. It is paid with private insurance and mostly by employer groups and the wealthier groups. There is availability of private medical insurance as part of a package of employment benefits, so that's mostly why the majority of private insurance is by them. It covers the cost of acute medical conditions, so disease, illness, and injuries, and it provides no emergency services and little primary care, including dental and optical care. So, an example for a cost for a woman in her 30s would be around €500, and that would be annually. However, this all depends on your age and your location and your medical history. So, technically, within a month, it can range from 20 to €100. So some of the statistics on private healthcare expenditures is that it fell by 1.4% in 2012 as compared to 2011, while the public rose by 2.4% in the same time period. However, National Health Service is paid largely by private insurance, and actually 11.5% of UK's population has some form of private medical insurance. So some pros with the private medical insurance is that you get shorter waiting times, you get very quick treatment, and you can actually choose your consultant and where you want to be treated. However, not all conditions are covered. It usually only covers short-term illnesses and injuries. You only get what you pay for, and it may not have the same depth of expertise as those within the NHS. So if your doctor actually works in the NHS as well, you may have limited visiting hours. So over the past few years, there has been many reforms in the National Health Services. And so some examples are that they need to give more power information for patients. That's a huge one. And increase the capacity for more hospital beds, doctors, and nurses. Provide more medical and nursing education, and to reduce waiting times in the public health system, which they would do so by encouraging more private medical sectors. New regulatory and inspection authorities, and to improve the cleanliness of hospitals. And these aims were aided by the largest increase in spending the NHS has ever seen. So here, this is a graph portraying the total healthcare expenditure in both the UK's public and private sector combined. And so as you can see, there has been a dramatic increase from 1997 to 2012, with an annual increase of 8% between 1997 and 2009, and it has slowed since then by a 1.6% increase until 2012, bringing the overall average annual increase to 6.7% from 1997 to 2012. Because of this dramatic increase overall spending of the National Health Service, um, they have come up with the Social Health and Social Care Act that came into effect 2013. So, due to the dramatic rise in costs in the NHS, the Health and Social Care Act 2012 came into effect, and some changes included were to provide more efficient health care, encourage competition with the private sector, and abolition of PCTs, or otherwise known as principal fund holders of NHS. So, what I've talked about earlier about the CCGs, this is the exact same thing as PCTs. However, the CCGs took over the PCT's role of as being fund holders and the responsibility of commissioning most local NHS services. The monitor is given the job to ensure appropriate competition of private companies, charities, and NHS organizations to provide care, and that is not affecting the service patients receive. So here's a picture portraying the primary care trusts and the clinical commissioning groups before and after the act took place. So here you see the before picture with the primary care trusts as the fund holders, and they control the dispersion of money to the general practitioners and the other healthcare services. And the after picture is the exact same thing, but the general practitioners take over the primary care trust's responsibilities. So, in summary, the National Health Services is actually one of the best publicly funded healthcare systems in the world. As with all healthcare systems, there are many demographic changes and technical advances and constraints financially that are putting increasing pressure on the services. The vision of NHS's drive is to be supported by choice and competition. There's greater patient involvement with the NHS system, so more access to information and health watch, and there's greater patient choice, so they can choose any provider, general GP practice, and treatment and choice of treatment. The replacement of PCTs by GP-led organizations is declared as the biggest change as of the 2013 Health and Social Care Act. It is believed that the NHS will be more efficient with improved quality of care with the new organizations of CCGs and their responsibilities. Generally, public satisfaction remains high with the general practitioner and their general practice.